Welcome back to Empire State Weekly, everyone. I'm Tim Lake in Albany. The state university system, SUNY, is taking new steps now to address mental health among its students. The SUNY Student Mental Health and Wellness Task Force will make recommendations on how to address students' mental health needs and prevent health risk like suicide at each of the 64 SUNY campuses. Now, the task force includes SUNY staff and faculty and state and national mental health experts. And joining us now here on Empire State Weekly to discuss this task force is the man charged with coordinating it, Dr. John Graham, who's the SUNY Associate Provost of Student Affairs. Thank you very much for being with us here on Empire State Weekly.
Thank you. I'm delighted to be here.
So I noticed when this task force was organized, a report from Penn State and also the New York State Suicide Prevention Report shows just a dramatic increase in the number of students now going to the counseling centers, and also, unfortunately, an increase in the number of students who say they were considering suicide over the past 10 years. So the New York State report came out. What did that find that led to this?
I can tell you this. The American Psychological Association has really been sharing a lot of key indicators, particularly from 2014 till now, about the number of students across the country, particularly young adults and adolescents, that are experiencing some measures of anxiety, depression, and suicide ideation. And so as we're keeping track of those data points, we're very concerned about how those data points align with SUNY. So the work that is taking place at Penn State and the governor's Suicide Prevention Task Force, we're sort of using that as our resource material as we continue to build our capacity on our campuses in the movement of this task force.
It's, of course, showing up in high schools as well, and it's such a difficult time of development, those young adult ages and becoming an adult. But do we have any sense of what the root of the cause is for this?
Well, some people would just tell you life. You know, college affordability is an issue, right, for some parents are struggling with their children. Then the other thing, too, is that we have a lot of children that are sort of growing up in a very complex world, and many of them are sort of struggling, not necessarily academically, but with some of their own social identities, right? How to identify themselves. And so we're looking for every measurable point that we can to help our students sort of decide who they're going to be, assist them in making those decisions, and let them know that whatever choice they make in their life, that SUNY is one of those institutions and systems that is there to support those decisions.
So, So Chancellor Johnson forms the SUNY Student Mental Health and Wellness Task Force. Give us a brief description of, and she put you in charge of coordinating it. Give us a brief description of the goal and what you hope to accomplish with this.
So this is very interesting. So we have an outstanding chancellor and we have a provost, really, that have shed a lot of light on this. And the impetus for that really comes from our board chair, Merrill Tisch, who's really concerned about student wellness from every aspect. And so as we talk about student success, we certainly cannot talk about student success unless we're dealing with the mental health challenges that students are having nationally as well as within our system. So the goal of the task force really is not to necessarily replace the work that campuses are doing, because our campuses range from geography to capacity of staff, but really to sort of augment what they're doing and help them reach the scale. Some of our campuses, especially in the North Country, some of them are having capacity issues with being able to meet with students, particularly those students who are in high school, who may be getting some interventions from high school, and they would like to have a continuation of that care when they get to college. And so some of our campuses are struggling to meet that demand. And so we're working towards that. So the goal of the task force really is to come up with a comprehensive set of recommendations for the board so that the chancellor and the board of trustees can scale those recommendations and then have high-level conversations with the office of the governor.
And you have quite a few different arenas that you're looking to form this task force, students, parents, and who are some of the other active members that you'll be seeking?
This is a really good question. So we have athletic directors involved, university police, residence life directors, vice presidents for academic affairs. We even have a few provosts there. But I got to tell you, the task force is co-chaired by two outstanding campus presidents, Dr. Deborah Stanley from SUNY Oswego and Dr. Wayne Rowley from Downstate Medical Center. So we've got the geography right with two outstanding presidents in two different parts of the state. So we feel that that's going to really bode well for us addressing all the key issues.
I'm curious what role that you anticipate parents will play, students will play for that matter as well. And then the other issue that Diane and I as parents and SUNY alum from years past are concerned about is now all the students are deeply involved with social media. And so we're wondering if that has an impact, and will that be explored by the task force?
It will be. And I got to tell you, we work very, very closely with the Student Assembly. This is a group of outstanding young men and women and older adult students that really are the ambassadors for the student population writ large across our system. We're going to be asking them some intelligent questions about social media and how they like to communicate with each other, because we can learn a lot from our students. It's not so much about those of us who are already educated. We also need to learn from our students. So this is a learning on both sides, but we're going to be able to shape some policy around this. But most importantly, we're going to be looking at destigmatizing what it means to seek help. And we want our peer students to be able to assist each other when they need
And
to.
it seems like discussions about mental health, this upcoming generation, they're much more open about it, and it's just a part of health. Are you looking into any of the mental health first aid programs that I'm seeing, where we're calling on individuals in the community to all be taking an active role in helping each other through mental health issues?
Yes, this is really a robust task force, and we're looking at working with those individuals that have direct experience of working with students and young adults at various levels. We're even considering having somebody from the faith-based community as a part of this process to really help us, scale our efforts. And we also have experts, national experts serving on the task force from the University of Maryland and the University of Michigan, two outstanding scholars, and they're going to be on a sort of a consultative basis with us in sort of making sure that what we're doing is as a part of those best practices.
So Dr. Graham, speak to us as parents. If I were to come to you as a parent of a SUNY student, I'm concerned about my child because I think there are some mental health issues. What's my role in relation to this task force that's forming?
This is very interesting. So one of the things that we would hope that our parents would do, because we have to be mindful of the FERPA law, right? We got to be mindful of the laws as it comes to our students and what we can ask them. But we want our students to
privacy issues.
Yep.
Okay.
Yep. So we want our students to self-disclose. So to the extent that the students will be willing to self-disclose and raise his or her hand and say, I have an issue, and I need some support. We want to have that environment that's welcoming for that. And I must tell you, on the whole, SUNY is very, very good at doing that. But we got to do better, and that's why we're forming this task force, so we can really get at these nuances. When it comes to parents, we want to make sure that we're paying a special attention to our students so that they can share with us the types of relationships that they have at home, because all of the relationships are not the same. So we're going to be sort of unearthing those kinds of questions as we move forward with the work of the task force.
And parents need to let go, but they don't necessarily just want to drop them.
Right.
At the same time, and there are privacy issues.
That's right. So we're going to be mindful, but we're also going to be conscious of the role of parents. And perhaps one of the recommendations might be that we come up with something that makes really good sense for parents to review and share in and weigh in. And we may even have one of our conference calls may even address those issues.
All right. Well, listen, I wish you all the best, because I know it's a very critical issue in this day and time. As you move forward with the mental health task force at SUNY campuses around the state. And thank you very much for being with us on our program today.
Well, thank you so much for the opportunity. I'm delighted.
We appreciate it. We'll have you back. Well, coming up, months after devastating flooding hit New York communities, one